Welcome back to Bugs and Beyond. Um, before we get started with all the bacteria and antibiotics and stuff today, I thought maybe we could take a second to just think about something good, you know, like something that made you happy recently, or like a small win that you had, or even just something that makes you smile. Sometimes it helps me to like remember something like that before I start learning something new.
Oh, yeah. I like that.
Yeah. So today we are doing a deep dive on daptomycin. This is a really powerful antibiotic that helps us fight infections. And we're going to go over like what it is and how it works and like the important stuff about how to use it and what the side effects can be. It's kind of like a crash course, I guess, with some fun facts too. And we'll even do a little pop quiz later to see how much you remember.
Awesome.
So to start, what exactly is daptomycin?
Daptomycin is an antibiotic, and it's actually produced by a bacteria. The bacteria is called Streptomyces roseosporus. But instead of causing problems, it's actually something we use to fight other bacteria.
So it's like bacteria fighting bacteria.
Yeah.
That's so cool.
Yeah.
Okay, but what makes daptomycin so special? Like, how is it different from other antibiotics?
Well, one thing that makes it different is its structure. It's a lipopeptide, which means it's got two parts. One part really likes fat, and the other part really likes water. And this is actually really important for how it works.
Oh, okay. I'm curious now. So how does that help daptomycin fight infections, having those two parts?
So you can kind of think of daptomycin like a little warrior that has this special strategy for getting into enemy territory. And the part that likes fat is like its little tail. And that tail helps it sneak into the bacterial cell membrane.
So like a ninja.
Yes, exactly. But it actually needs a little bit of help to get in, and that's where calcium comes in. So the calcium kind of acts like a key, and it lets the daptomycin bind to the membrane of the bacteria and then get inside.
So it needs that calcium to get in.
Yeah.
Okay, what happens once it gets inside?
So once the daptomycin is inside, it basically starts wreaking havoc. It disrupts the cell membrane, and it ends up making these little channels. And then those channels let potassium ions leak out.
So it's like poking holes in a water balloon.
Yeah, that's a great way to think about it. And then as the potassium leaks out, the bacteria can't keep its balance anymore, and eventually it dies.
Oh, wow. So it's a really sneaky and smart way to kill bacteria.
Yeah, it is. And there's actually another really important part of this whole process. So unlike some other antibiotics that make the bacteria burst open, daptomycin doesn't actually cause that kind of rupture.
Okay. Why is that important?
Well, when bacteria burst open, they release these toxins. And those toxins can cause a lot of inflammation because our immune systems react to them.
Oh, so it's like it avoids causing more damage.
Exactly. So because it doesn't cause the bacteria to burst, it doesn't trigger as much of an immune response. And that can be a good thing sometimes, especially if there's already a lot of inflammation going on.
Interesting. So it kills the bacteria, but it doesn't cause a huge mess while it's doing it. Okay, so which bacteria are most vulnerable to daptomycin?
So daptomycin mostly works against gram-positive bacteria. And that's a pretty big group of bacteria that have a certain structure in their cell walls. We're talking things like Staphylococcus or aureus and Streptococcus pneumonia. Those can cause all sorts of infections.
So daptomycin has a hit list of gram-positive bacteria that it's really good at getting rid of.
Yeah. And it's a good choice for treating things like skin infections, bloodstream infections, and even really serious infections of the heart and bones.
Wow, so it sounds like a really important tool for fighting these infections.
It definitely is. But it's important to remember that it doesn't work for everything. There are some infections where it's just not that effective.
Like what?
So one example is pneumonia. Pneumonia is an infection in the lungs, and daptomycin isn't very good at treating it. And that's because we have something in our lungs called lung surfactant. And that actually inactivates the daptomycin. It protects the bacteria from the daptomycin.
So it's like daptomycin's kryptonite.
Yeah, exactly. And another important thing is that it doesn't penetrate the central nervous system really well. So that means it's not effective against infections in the brain or the spinal cord.
Right, so there are some places it just can't reach.
Yeah.
Okay, so we know it's good against certain bacteria and not so good against others. What happens to it once it's in the body? How does it get around and how does it get out?
That's a great question. So the whole process of how a drug moves through the body is called pharmacokinetics. We basically track the drug's adventure from beginning to end.
Cool. So tell me about daptomycin's adventure.
So it all starts with how we give it. And this is important. Daptomycin can't be taken as a pill because it has what we call poor bioavailability. That basically means it doesn't get absorbed from the gut very well.
So no popping a daptomycin pill?
Nope. It has to be given intravenously, so through an IV.
Directly into the bloodstream.
Okay.
I mean, and then?
Once it's in the bloodstream, it gets distributed all over the body to those places where the infection is. And one interesting thing about daptomycin is that it has a pretty long half-life.
Half-life. What does that mean?
So half-life is the amount of time it takes for half of the drug to be eliminated from the body. And daptomycin's half-life is usually around 8 hours. But if someone has kidney problems, it can be way longer, like up to 28 hours.
Whoa, that's a big difference. So people with kidney problems might not need to take it as often.
Exactly. And another thing about daptomycin is that it's what we call highly protein bound. So that means that a lot of the drug that's in the bloodstream is actually stuck to proteins.
So it's hitching a ride on the proteins.
Right. And that can actually affect how the drug works and how it gets eliminated.
Interesting. So it's not just a simple journey through the body. There are a lot of different factors. What about the dosage? If a doctor wants to give someone daptomycin, how do they decide how much to give them?
Well, that's where it gets a little more personalized. There's not one dose that works for everyone. It depends on the patient's weight. And we also have to think about their kidney function and whether they're obese. But for someone with healthy kidneys who has a complicated skin infection, we usually start with 4 milligrams per kilogram of body weight. And we give that once a day.
So it's kind of like tailoring a suit. You have to get the measurements just right.
Yeah, exactly. We want to make sure the dose is high enough to be effective, but not so high that it causes problems. And like we talked about, people with kidney problems might need to take it less often.
Got it. What about side effects? What are some of the things that people should be aware of?
So like you said, every medication has potential side effects. And with daptomycin, one of the bigger concerns is muscle damage. It can be anything from mild muscle pain or weakness to something more serious called rhabdomyolysis.
Rhabdomyolysis, what is that?
So it's basically when muscle tissue breaks down, and that can release harmful stuff into your blood, and it can even hurt your kidneys.
Yikes. So that's not good.
Yeah.
How do doctors check for that?
We look at a blood test called creatine phosphokinase, or CPK for short, and that's an enzyme that gets released when muscles get damaged. So if the CPK levels are high, it can mean that there's some muscle injury. And we have to be really careful with people who are also taking statins.
Oh yeah, statins. Those are the cholesterol medications, right?
Yes. And the problem is that statins and daptomycin can sometimes interact with each other, and that can make the muscle damage worse. So if someone is taking both, we have to be extra careful and watch their CPK levels really closely.
It's a good reminder to always tell your doctor about all the medications you're taking.
Yeah.
Are there any other side effects with daptomycin?
Yeah, there's another one that's rare, but it can be serious. It's called eosinophilic pneumonia, and it's basically a lung reaction that can cause fever and cough and trouble breathing. We think it's probably an allergic reaction to the medication.
So it's like inflammation in the lungs.
Right. But I want to be clear that even though these side effects are serious, they aren't very common.
Yeah.
Most people do fine with daptomycin, but it's always good to be aware of the risks.
Definitely. Okay, so another big issue with infectious diseases is bacterial resistance. Do bacteria develop resistance to daptomycin?
Oh, yeah, they definitely do. Bacteria are really good at figuring out how to avoid things that are trying to kill them. And daptomycin is no different. So one of the ways they do this is called diversion. It's basically when they change the makeup of their cell membrane, so it's not as attractive to the daptomycin anymore.
So they're like, get out of here.
Exactly. And we mostly see this kind of resistance in a bacteria called Enterococcus faecalis. Another way they resist is called repulsion. So that's when they change the charge on their cell surface, and that makes it harder for the daptomycin to bind to them and do its job.
They're like putting up a force field.
Right. And this kind of resistance is more common in Staphylococcus aureus and Enterococcus faecium. And the problem is that when bacteria develop resistance, it becomes much harder to treat those infections.
It's a constant battle. So are there any ways to fight back against this resistance or make daptomycin work better?
Yeah, there are. So sometimes we can actually combine daptomycin with other antibiotics, and that can actually make it more effective. For example, there are these antibiotics called beta-lactams, things like penicillin and cephalosporins. And those can sometimes help daptomycin bind to the bacteria better, which makes it harder for them to resist.
Huh, that's interesting. So sometimes it's not about finding new antibiotics,
Yeah.
but about figuring out how to use the ones we have in new ways.
Exactly. So now that we've talked about all that, I have a little pop quiz question for you.
Okay, I'm ready. Hit me with it.
Okay, so daptomycin kills bacteria by A, disrupting the bacterial cell wall,
Okay,
B, inhibiting bacterial protein synthesis,
okay,
C, interfering with bacterial DNA replication,
okay.
or D, forming channels in the bacterial cell membrane that lead to ion leakage.
Okay, so I have to think about this one for a minute. We'll give you guys some time to think about it too. What do you think the answer is?
I think I know the answer. But I'm going to let everybody else have a few more seconds to think about it. Okay, time's up. The correct answer is deforming channels in the bacterial cell membrane that lead to ion leakage. Remember how we were talking about daptomycin acting like a ninja? It sneaks into the membrane and creates those channels, and then potassium leaks out.
Yeah.
And that's what kills the bacteria.
Yes, that's right. And the other options, those are how some other antibiotics work. But daptomycin is special because it does it this way. It's really effective against those gram-positive bacteria. I love when there's like a little trick to help you remember something important. Do you have any mnemonics for daptomycin? Like for how it works or anything?
I do, actually. How about calcium channel chaos? So calcium, because we need calcium for the daptomycin to bind to the bacteria, and then channel for those channels it creates, and then chaos, because that's what happens to the bacteria when the potassium leaks out.
Oh, I like that. Calcium channel chaos. It's catchy. What about for the side effects? Do you have one for those?
Let's see. For the muscle stuff, how about my painful muscles? So for myopathy, which is one of the side effects, and then painful muscles, because that's what can happen. And it's a reminder to check those CPK levels, especially if someone is on statins.
Perfect. Two good mnemonics. Okay, so thinking bigger picture now. When would a doctor choose to use daptomycin instead of a different antibiotic?
Well, it's a good choice for those serious gram-positive infections we were talking about, like skin infections, bacteremia, endocarditis,
Yeah.
and osteomyelitis. It's especially helpful if other antibiotics aren't working or if the patient can't take them for some reason. But we always have to keep in mind that it's not perfect. Like, it doesn't work for pneumonia because of the lung surfactant thing, and it can't get into the brain very well. So it's not good for infections there.
Right. It's not a magic bullet.
Yeah.
But it's definitely an important tool. And like with all antibiotics, we have to be careful not to overuse them because that can lead to resistance. And we were talking about how bacteria have those sneaky ways of resisting daptomycin, the diversion and repulsion things.
Yeah, that's a really important point. We have to use antibiotics responsibly, only when they're really needed. If we overuse them or misuse them, then we're just helping the bacteria get stronger and harder to kill. And that makes it much harder to treat infections in the long run.
So it's about being smart and protecting these important medications. So for everyone listening out there, what's the most important thing you want them to remember about daptomycin?
I think the main thing is that it's a really unique and effective antibiotic, but it has its pros and cons. It's great for those tough gram-positive infections, but it's not a solution for everything. It's important to understand how it works, what bacteria it's good against, what the side effects can be, and how resistance can develop. That way we can use it safely and make sure it keeps working.
Right. And those mnemonics will definitely help people remember the important stuff. Calcium channel chaos and my painful muscles.
Exactly. Those are good ones. We've talked about a lot today, but this is really just the tip of the iceberg when it comes to infectious diseases.
It's a huge and fascinating world, and it's always changing. There are new challenges all the time, but there are also new discoveries. So to wrap things up, I have a question for everyone listening.
Yeah.
As bacteria keep evolving and getting better at resisting antibiotics, what do you think are the most important things we need to do to keep fighting back? What kind of innovations or strategies will be most important?
That's a great question. And it's something that a lot of people are working on right now. It's a complicated problem, so there's no easy answer. But I think we need to do a few things. We need to keep researching and developing new antibiotics. We need to look for other kinds of treatments too, not just antibiotics. And we need to make sure that we're using the antibiotics we have responsibly, not overusing them. We need to be good stewards. And I think the most important thing is that we all need to understand how complex this issue is, how humans and microbes and the environment are all connected.
That's so true. It's not just about finding the next wonder drug. It's about changing how we think about infectious diseases and how we approach the problem. We need to be proactive, not just reacting when something bad happens.
Yes. We have to be informed and make good choices. And we need to support the people who are working on new solutions.
And who knows, maybe someone listening right now will be inspired to work in this field and help make a big difference. Okay, so before we finish up our deep dive into daptomycin, I just want to remind everyone to like and subscribe and share this episode with anyone who might find it interesting.
It was great talking about this with you.
Yes, it was fun. And a big thank you to all of our listeners for tuning in. We'll be back soon with another deep dive into the world of microbes. Until then, stay curious and stay healthy. See you next time for more Bugs and Beyond.